Who wants to feel younger and happier? How about regaining energy, muscle strength, and the ability to lose weight? Those are some of the benefits of hormone replacement therapy. So how does it work and who is it right for? Dr. Gary Donovitz is the founder and CEO of BioTE Medical, and Dr. David Sharp practices internal medicine here in Omaha. Gentlemen, thank you so much for being here.
Thanks for having us.
Absolutely. Let's start. People have probably heard all about hormone therapy. What is it and how does it work, Dr. Donovitz?
Well, hormone therapy is not all created equal. For us, we actually optimize hormones. We use bioidentical hormones, the same as your body made, whether it's a female or a male. We get your hormones where they were when you feel your best. How they work is they make you feel good. They give you better energy. They make you sleep better. They allow you to lose weight, particularly across the midsection. They improve your sex drive and sexual performance, and you get rid of that brain fog, so your brain works better. In fact, you're really just happier all around.
Well, I'm in my early 40s now, so some of the things you're talking about are kind of starting to sound familiar. Pellets. People have heard this term. You have a little one here. Why don't you hold this little guy up and explain what pellet therapy is?
So these pellets, they're all bioidentical hormones, either testosterone or estrogen. What we do is put them back here in the hip. It's painless going in, and the nice thing is they last for 3 to 4 months in women, 4 to 5 months in men, so you only have to do them a couple of times a year. Not having to take a pill every day, not being on a roller coaster ride with your hormones is a great thing. Putting creams on gives you big spikes in your hormones. Taking a pill every day is not going to optimize your hormones, and in fact there is no bioidentical testosterone you can take orally. And doing shots, how would you like to take 100 shots a year?
I wouldn't.
Me either.
People may have also heard of synthetic hormones. What's the difference between what you do and synthetic hormones?
Right, so synthetic hormones are like shots. They have to go to the liver and be converted to testosterone. That's not really good. They have other problems. So synthetic hormones are in an oil base. They can give you scarring. Moreover, synthetic hormones don't give you the same response as bioidentical hormones. Your body never saw synthetic hormones. Your body saw the real thing. The other problem with synthetic hormones is the side effects are more. So taking shots or using synthetic hormones is never going to be as good as bioidentical hormones. Bioidentical hormones can optimize your hormones, and the outcomes are better with way less side effects.
Why do some doctors not like these?
I'll tell you, most doctors that don't like it don't know about it. If you're not up on it, you're down on it. So there lies the problem. For us, once we train physicians in how to use bioidentical pellets, how to put them in, and they see how good their patients do, it's life-changing. Changing people's lives is fascinating. There's nothing fascinating about a pellet, but changing people's lives is fascinating. Doctors just don't know sometimes.
Right, this little guy isn't necessarily as exciting as the things that patients can see, and that's why I want to bring Dr. Sharp into the conversation. You practice medicine here in Omaha. You're giving these pellets to patients, putting them in their backs. What benefits are your patients seeing?
Well, I've been in practice in Omaha nearly 20 years. And the majority of that time I was in disease management practice, so traditional practice of medicine where you're throwing pills at disease symptoms basically, diabetes, hypertension, obesity, sleeping pills, things like that for different medical problems. So the last 2 years I've been able to switch my practice to a more progressive, I think, way of practicing medicine where we're actually able to take people off a lot of certain types of medications because they're feeling so much better. We're able to, as we age, our hormones start to drop off. Before we're 40 years old, there's really not a lot of disease processes that hit us. After 40 or 50, those disease processes start to become more of an active problem. And women get heart disease, men get heart disease. There's more diabetes and obesity and sleeping issues as well. And that basically has changed the way that my practice is and the way my patients have been able to appreciate the care that I give them.
You mentioned sleep. This happens to be Sleep Awareness Month, so hormone therapy does help with that. What kind of improvement do patients see?
Well, I think a lot of it has to do with when you optimize hormones, testosterone and estrogen, estradiol both, but mostly it seems like the testosterone, that women and men both get benefits from that, from their sleeping patterns. They sleep or deep sleep, they have more restful sleep. They are more motivated during the day, so there's more exercise going on during the day. Typically people will be more motivated to take care of themselves, so they're losing weight and kind of getting a positive feedback from that whole process. So there's definitely a good awareness now with the sleep
You know, we should also mention that what we do has been shown in multiple studies to actually reduce women's risk for breast cancer.
Right.
Nothing else hormonally works like that, and the reduction is significant. So if women could have less breast cancer, or if breast cancer survivors could take hormones, that would be great, and we do that for people. So not only do we reduce heart disease, we prevent osteoporosis, we protect the brain, but for women we reduce breast cancer, and it's a big thing.
Yeah, testosterone is a very powerful anti-inflammatory. So it has a strong effect on the aging brain, has a strong effect on reducing breast cancer by 7-fold. It also has no increased risk for prostate cancer, and also there's good studies out now that show there's a significant reduction in cardiovascular disease.
I want to summarize 2 important things, because we started off by talking about those things that bring people to you. I can't lose weight anymore, I have no energy, I have no interest. Those things are all important, and this can help with that. But we also discussed that prevention of diseases, so you're not getting into that age-related cycle. So really it's a twofold system. And also, people want to know, how quickly could this work? How fast can they see some improvements in their lives?
Typically, for women, it's about 3 to 4 days. For men, maybe 7 to 10 days. So we do the procedure. It's really quick, easy. It takes maybe a couple minutes to do it in the office. And the pellets are basically built. They're solid. They're built like a bromine tablet in a hot tub. They slowly dissolve over a longer period of time. The more cardiovascular output you have, the more exercise you do, the more quickly you'll run through the pellets. But typically within a week or so, you'll start noticing an improvement in your overall well-being.
Well, I think all of us who are aging realize there's not really another option. You've actually written a book. Can you tell us a word about that?
Yes, so I wrote a book called Age Healthier, Live Happier, because really the whole idea is for people to not be on so many medications. We're over-medicating everybody. Wouldn't it be better to age appropriately, healthier, have a greater quality of life, no matter what your age? So we will use hormone optimization no matter what your age, because we believe everybody's entitled to a great quality of life. And that's what the book's about, how we have gone from over-medicating to actually living healthier.
Dr. Donovitz, it's a pleasure to have you here. You are not Omaha-based. Dr. Sharp, you are. You're the creator of this system, and there's a lot of providers here in the Omaha area. You can see the map there on the screen. We've also been showing Dr. Sharp's office information on the bottom of the screen throughout this visit. If you're intrigued, if you're going through some of these things like I am, and you want to recapture some of that vitality, if you want to take the opportunity to maybe not get into that cycle of just throwing medicine at diseases that hit us as we're aging, it's a great opportunity to check it out. For more information about BioTE Medical, you see the 1-800 number on your screen as well. The website, BioTEmedical.com. Gentlemen, thank you very much. An interesting conversation, and one that I think a lot of us can relate to.
Thanks for having us.
You bet. The Morning Blend continues in less than 3 minutes.